Good morning. I'd like to welcome you to our webinar today, Managing an Infectious Disease Outbreak on a College Campus. Today's webinar is sponsored by the GLCUHO Contemporary Issues Committee. My name is Jeremy Alexander. I serve as the Technology Coordinator for GLCUHO. I am hosted at Eastern Illinois University, and I'll serve as your moderator for today's webinar. Before we begin the webinar, I'd like to go over a few housekeeping items with you to help to maximize your learning for this session. To ask questions, type your questions in the question and answer section. This will be at the bottom of your window. The presenters will answer questions as quickly as possible, but we want to make sure that there's enough time to cover all of our materials. Should you experience any problems, please type in a chat box and I'll work to assist you. You can also email me at technology@glcuho.org. At the end of this session, the presentation and the audio recording will be available on our website at glcuho.org under the webinar archives on the resource tab for your future reference. We encourage you to share this resource with your colleagues who are unable to attend. At this time, I'll hand it over to Veronica from the GLCUHO Contemporary Issues Committee to get us started today.
Hello, everyone. My name is Veronica Roberts. I am hosted at Franklin College. I am a member of the Contemporary Issues Committee. This year's contemporary issue is emergency preparedness. We are glad to welcome you to our first webinar in our summer series. We hope you'll join us for future webinars, and we're very grateful for Mark Denny to share his expertise with us. So take it away, Mark.
Okay, hello everyone. Good morning, good afternoon. I'm not sure what time zones folks are in. I'm Mark Denny. I'm the Senior Director for Health Services at Temple University in Philadelphia, Pennsylvania. What I'm going to be talking about today is based on our experience just this past semester, spring of 19, with an outbreak of the mumps. So a couple things before I talk about objectives. This is definitely from a student health point of view. So it's a little clinical, but I tried to make it generic enough for those in housing. I know we have a different audience and a wide range of folks listening. So I tried to make it applicable to everybody and tried to get not too deep in the weeds of medical issues. Can be a very intensive topic. We could talk for hours or days, or at least I could. So I'm going to try and get into everything, take you through the entire outbreak experience from planning to post-brief analysis, everything. Very briefly, and add some time at the end for some questions. Also, one disclosure, I'm used to doing these types of presentations in front of people, so I know if they're laughing at my corny jokes or if they're rolling their eyes. So I'll try and keep those to a minimum. And we'll get started, talk about some of the objectives. Okay, so we're going to try to understand the origins and contributors to current cases of mumps in the United States. Describe the formation and management of an infectious disease outbreak task force, as well as talk about infectious disease policy at universities. Describe the successful development of a communication plan to provide important infectious disease outbreak-related information. Identify the initial steps and sequence of events of an outbreak investigation and a response on a college campus. Identify the necessary elements for a successful implementation of mass vaccination clinics, and also how to coordinate with local, state, and even national public health officials. Then we'll talk about some of the barriers to outbreak management and talk about some strategies to overcome them. I'm going to kind of talk about the barriers throughout the entire presentation and not just at the end. And then we'll definitely have some time for questions at the end. So just real quickly, talk about mumps and what is the mumps, talk about why it's here and how we kind of got to where we are. It's a viral infection. It spreads through direct contact with saliva or respiratory secretions. We'll talk about that, not the most pleasant topic, but we'll talk about that a little bit more and why that direct contact is important in terms of transmitting the disease. The signs and symptoms are similar to the flu. So it's body aches, fever, loss of appetite, and then the real thing that distinguishes it from the flu is jaw swelling or jaw pain. It can be on one side or it can be on both sides. It really presents different ways. Folks are considered to be contagious for 5 days after the onset of symptoms. That 5 days is also important, and that'll come up a few times during the presentation. Another issue or thing that's unique to the mumps, the symptoms may not appear for up to 25 days after someone is infected. So they could be affected on July 1st, and they won't know that they have the disease until July 21st, July 25th. So that's a unique challenge to the mumps. My staff here in student health, many of them have been practicing for over 25 years in either family medicine or student health. None of them had ever seen a case of the mumps before. So that gives you some idea of just how rare it was, and it's becoming much less rare now. There is no cure for the mumps. You can only treat the symptoms. It really just has to run its course, which is not something that folks frequently like to hear. That's a picture of what it looks like. If there's any hockey fans out there, I'm a Philadelphia Flyers fan, so seeing Sidney Crosby here with the mumps was not something that was disappointing to me. But the National Hockey League did have a mumps outbreak and some issues with the mumps back in 2014. So we'll just talk kind of about where we've been and what's the progression of mumps, and how often is it happening now. So as you can see, starting around 2000, there are very few cases of mumps, less than 350. That was the case in the 90s as well. Vaccine, the MMR, measles, mumps, and rubella vaccine, came out in 1967 and was really starting to be implemented in 1971. Prior to that, the United States would see 186,000 cases of mumps every year. And the vaccine did a very good job, got us down to the low hundreds with really good implementation of that. But as you can see, we started seeing the numbers increase. Starting in 2006, really started in the Midwest, started at a university in Iowa, where they started an outbreak of the mumps. It spread to Kansas and several other states in the Midwest. That wasn't specifically college, but there were 30% of the folks that were infected were on college campuses. They did some analysis afterwards, and of the folks that they did know their vaccine history, 65% of them had 2 doses of the MMR vaccine, which is what the recommendation is for folks entering K through 12 as part of their pediatric vaccinations. You can see in 2009 and 2010, we had another little spike. That was primarily in New York and New Jersey. That was at a religious summer camp. That was some younger age students. They were, average age was 15. 75% of those folks also had 2 doses of the MMR. So this isn't only affecting unvaccinated people, it is affecting folks that had the vaccination. And we'll talk more about the vaccination in a second. Then in 2016 and 2017, there's really 2 years in a row that we had large spikes, and there were a number of universities that were affected by that. University of Illinois, Penn State, there's a couple universities in California, as well as Iowa again. And that's not an all-inclusive list, but that's a few of the universities that were affected. So this is just a map and some of the numbers for this year in 2019. Pennsylvania, where I am, is one of the brighter colors because we've had almost 300 cases statewide at this point. This data is as of last week, or as of June 21st. So it's very up to date. There have been almost 1,500 cases in 44 states so far this year. Many of those have been in universities. Penn State has had more cases, University of Arkansas, Indiana University, Marquette, San Diego State. So there are a large number of universities that have been affected. You can see Texas stands out there as well. The Texas isn't specifically universities, but in Texas, it's actually immigration detention centers have had an outbreak of the mumps. So that's where the effect comes from there. So how did we get here? Why is this starting to happen now? So vaccination rate back in 1998 was 92% nationwide. By 2017, that's gone down to 91.1%. 0.9% may not sound like a lot, but when you look at the entire population in the United States, it's almost 3 million people. So that means between 98 and 2017, there are 3 million more unvaccinated people walking around. So that's a lot more potential for the disease to spread. Another thing about the vaccine itself, I mentioned 2 doses. That's the recommendation for the measles, mumps, and rubella vaccine. The mumps portion of that is only about 88% effective if you have 2 doses. If you have 1 dose, it's about 78% effective. And within that, you can have a range. Some folks may be as low as 65%, and others may be 97%. One thing I will mention, the measles portion of that, because there are several measles outbreaks going on throughout the country right now. The vaccine is much better for the measles. It's about 97% effective for the measles. So if you combine 3 million more unvaccinated people with a vaccine that's only 88% effective, there's really the opportunity for there to be an outbreak. Now, really a third cause or a third contributing factor is just the increase in world travel and outbreaks throughout the country, or throughout the world, I mean. More people are traveling. There was an outbreak in the United Kingdom back in 2005. There was over 63,000 people that were infected with the mumps in that outbreak. That's still going on now. They had about 1,300 cases last year. In Ireland, they have about 500 cases last year. So there are places where Americans travel that have outbreaks of the mumps. So one of the contributing factors are that folks travel to a place that there's an outbreak, and then they bring it back to the United States. I really like this graph. It shows the amount of travel in 1995. Little over 663 million people were traveling then. And then just in 2017, that was up to 1.5 billion. So more people traveling internationally just gives more opportunity for any kind of disease to spread, not only the mumps. So why college students? Why are they susceptible, and what are the risks that are specific to college students? It's really not only college students. It's really any close-knit community. So you will see there are some religious communities that live in close proximity and spend extended periods of time with each other. But college campuses are really at risk for this type of infectious disease or any other infectious disease, and are really ripe for it to spread and to contract and keep going. College students, they live in very close proximity to each other. You know, they live in apartments or residence hall rooms. There may be 4 to an apartment, 10 to an apartment. If you have a large Greek community, there may be 20, 30 more students all living under the same roof in very close proximity to each other, spending a lot of time with each other. Also, I know everyone here, I believe, works in a college, so you know the college lifestyle. Students, a good portion of them like to party. And if you can just imagine a party situation when there's 100, 200 people, 6, 7 inches from each other, shoulder to shoulder, very close proximity. You know, someone sneezes, someone coughs. That's where the way this spreads through respiratory secretions can really spread very easily and very quickly. Students also share cups, share drinks. They may share food in the dining halls, share cigarettes, e-cigarettes. They may kiss 1 or 2 or 3 or 4 or 5 different people. So all of these things are contributing factors that really put college students at risk to spread any form of infectious disease. One other risk factor is a pro-con. Mumps is typically, especially now in 2019, most cases are mild, and the signs and symptoms are very mild. So students may be sick, but may feel like, oh, I feel fine. They won't even realize they're sick, and they go out and can spread the disease more. And we'll talk about some of the challenges of that in a few minutes, and how that affects some of the communications and some of the decisions we make. So just a couple basic things about Temple University. We are located in Philadelphia, Pennsylvania. We're in Philadelphia County. We have 3 campuses in Philadelphia County. Our main campus, we have a health science campus, as well as a campus in Center City, part of the city. The reason I mention the counties, that's really where the Department of Health is located. Most states have county departments of health, and that's going to be who you're going to work with to manage a disease outbreak like this, like the mumps or anything else. We do have 2 other smaller campuses in outside counties. So if you do have a big university, you may be working with multiple departments of health. We're very fortunate that Philadelphia is a very robust Department of Health, and we work very well with them. So they really take the lead. Anything in the surrounding counties, Philadelphia takes the lead when it comes to that. What we're talking about today is really main campus. That's where all of our cases were. We're all focused on the university's main campus. So a little bit about Temple University, just to give you some background. We have a little over 40,000 students. On any given day, there may be 30,000 students on the main campus. We do have some commuting students, but most of them are living in and around campus. We have roughly 6,000 that are living in Temple-owned or sponsored housing, another 10 to 15,000 in our immediate zip code in the immediate area surrounding the actual college campus. We have 6,000 faculty or staff. So we really are a small city in a small town within a very large city. We have 2,200 members of Greek organizations. We'll talk a little bit more about why that's important and good to know in a few minutes. And we also, in the spring, we had 205 athletes that were in season and had matches or games and were traveling to different campuses and different universities. And then we also had 113 football players that were participating in spring practice. So Temple Student Health, we have two offices. We do have one in our health science campus, really focusing in again on that main campus. We are part of the physician's practice plan within the Temple Medical School, so we are not part of student affairs, although we definitely work very closely with student affairs, and we'll talk about some of those things in just a minute. Just to give you an idea of our staffing and our size, we do have 4 full-time physicians, 4 full-time nurse practitioners. We have a nurse manager, 7 other registered nurses. We have an IT specialist who, if you don't have one, I highly recommend. I can't tell you how important he was to almost everything we did, from communications to compiling data, just a fantastic resource, and we're very glad to have someone dedicated just to student health. We also have some medical assistants, various administrative staff. I also oversee our employee health office, located in the same building as student health, much smaller staff. They have 1 physician, 1 nurse, and 1 administrative person. Temple is also very fortunate that we have an office of emergency management. So work very closely with that office, especially during this outbreak and during a lot of the planning we did leading up to the outbreak. So I'm going to talk about our timeline. I'll talk real specifics about what happened in the very beginning and how we were notified, how the communications went, and kind of how we handled the initial first few days of the mumps outbreak. Mumps outbreaks typically take place at the end of the winter, beginning of the spring, which was certainly the case for us. This was the end of February. So Tuesday, February 26th, a student contacted the Dean of Students office via email just to let them know that they missed classes, and the reason for missing classes was that they were diagnosed with the mumps. So I have a great relationship with the Dean of Students. She immediately emailed me and just said, "Mark, do you know anything about this?" Hadn't heard anything, didn't know anything. So I went out, talked to our clinical staff, and remember, none of them have ever seen a case of the mumps. So went out, talked to them, told them the email I had just gotten. There was actually 1 person in the office that had some jaw swelling, that the clinician wasn't thinking mumps until I said that, and they're like, well, maybe they do have the mumps. We looked on our schedule. We had 2 more people that later that afternoon who were also coming in with some jaw pain and jaw swelling. Another clinician had another person earlier that day. So we had 4 people in that first day that had the signs and symptoms that were suspicious for the mumps. So immediately contacted the Philadelphia Department of Health, have a great relationship with them. Temple is a closed pod facility, so we help the city distribute medications. We're a point of distribution pod. So if there's ever a mass casualty event or some larger scale infectious disease event, we would help distribute the vaccines to them. So we'd already participated in a lot of emergency planning, a lot of preparation to handle something like this. So I knew who to call, knew who to contact. They confirmed that they had no reported cases at that point in time. So we weren't sure what we were dealing with. Was this the mumps? Was it something else? They wanted us to test the 4 folks. So they sent supplies, they picked up the test. There's a few different tests to do. I don't get too crazy clinical, but most of the tests don't really help in an outbreak situation. There's really only one, it's a swab of the cheek. That's very helpful in this situation. So we tested the 4, sent it back to the Department of Health, waiting for the results. At that point, I also contacted other folks in the university. Just sent an email to members of our infectious disease task force. There's an entire group, and I'll talk about that makeup in a second. But I let the Dean of Students know, General Counsel, the Director of Emergency Preparedness, and someone in the Provost office. Just gave them a heads up that, listen, we had these 4 students come in. There were also a few rumors on campus of students having the mumps. And just to let them know, this is going on, we're investigating. There's really nothing else to do right now. The Department of Health has no positive cases. So at this point, we can't confirm anything. Wednesday, the next day, no new patients. And by that time, we had gotten in contact with the student who emailed the Dean of Students, talked to her, talked to her mother, and we're really getting mixed stories. And there's no confirming lab tests, no confirming diagnosis. She met with one physician who said she had the mumps, another one who said, no, we think it's something else. So we really weren't sure what we were dealing with. And at the end of the day, Wednesday, we thought, well, this may not be the mumps, it may be something totally different. That was all about to change pretty quickly. So Thursday, we had 3 more students show up with the signs and symptoms of the mumps. By the end of the day, at about 4:45, the tests for those 4 original students came back, and they did come back positive. So just before 5 o'clock, the test came back positive, and the Philadelphia Department of Public Health declared an outbreak at Temple University. So at that point, we really tried to rev things up. I enacted our infectious disease policy. Talk more about those details in a minute. By 7:30, we had already gotten a conference call of our task force together to determine next steps, to really try to get a communication out on how we were going to best handle this outbreak, to try to get in front of things as best as we could. The other detail and the other contributing factor, spring break was going to start the next day for us. So March 1st, 5 o'clock, campus was going to empty out. Students were going to travel all across the country. Those of you who have seen outbreak movies in the past, and you see the map of the United States with the red lines spreading the infection to different areas of the country, different areas of the world, that was kind of my nightmare right there, thinking that that red dot is starting in Pennsylvania, starting at Temple, and we're now spreading the mumps all over the country to Florida, Mexico, New Orleans, every place else. So we really wanted to get a communication out as quickly as possible so that the students would have as much information as they could. So got a conference call together by 7:30 that night. So really within 2 hours of getting the first positive test, we had a call with all the key people throughout the university together. And by 9:30 that night, we sent an email out to the entire university community. Really don't think it could have gone any smoother, any quicker. We've had some post meetings and post debriefings. Getting a notification out to the whole community within 5 hours of getting a positive test was pretty incredible, and I'm very lucky for the support we have here at Temple. So I'm going to back up a little bit and talk about some of the planning that enabled that communication to go out as efficiently and as quickly as it could. I've been at Temple for 15 years. I've been the Director of Student Employee Health for that long. Shortly after I got here, we had the swine flu epidemic, H1N1. Prior to that, there was SARS. I'm not sure how many of you may remember that, but that was back in the early 2000s. So all we had during H1N1, I inherited 6 3-inch binders of a policy of information on what to do for SARS. That was it. There was no other policy, no other protocols, nothing. And what I quickly found out was none of it was applicable to the swine flu, to H1N1. So quickly had to kind of regroup, decide what we're going to do, and kind of go out on our own and figure things out during H1N1. Same thing for Ebola, Zika, everything's a little different. So what we did with our infectious disease policy, we kept it very simple. It's 1 page. And there's really 2 sections of it. One of them is 4 major goals, and we're going to talk about those goals specifically. And two of those goals, after going through this experience, can really be combined. Number 1 and number 4, communicating effectively during all phases of the emergency and educating the university community. We really combined the two of these goals into one. All of our communications was also to educate the community and keep them updated. The other two major goals, identify and treat those who are sick, and also prevent others from getting sick. So our infectious disease task force, we're very good about setting this up and very deliberate about getting representation from all over the campus, really establishing that chain of communication. I'm very lucky that I have access to folks high up in the provost office, just one person removed from the provost. So when it comes to having to make decisions, I have their backing and I have their ear. I'm also someone who stays very calm in situations like this. So if I call and ask for something or I raise an alarm, they really know it's the truth and they trust me, and that trust and relationship is vital to things being successful and really moving in a great direction in terms of being efficient and handling things quickly and appropriately. So the members we have on there: provost office, my office, student employee health, student affairs, really including someone from housing and the dean of students. The housing component is really important. That's where all the students live. We have 6,000 of them living in our housing. Those are students we can get messaging out very easily, and the cooperation of the housing folks is vital to managing any kind of outbreak. Also, campus safety. HR really depends on what the outbreak or the situation is, how involved HR gets. University communications, you'll see a few slides, and we'll talk about communicating a lot. That is so key. I cannot emphasize how important the relationship with your communications folks is. University council, because we always have to have a lawyer involved. Also, the Office of Emergency Management. They were definitely involved, really my right-hand person when trying to manage all of this. So communication. One of the most important things during everything, it really affected everything we did. So having a one-point person within your university communications department is vital and key. You really have to have that. Also, appoint a spokesperson, whether it's somebody from student health, it can be somebody if you're affiliated with a hospital, it could be somebody from communications. You know, it really depends on what works best with your staffing and with your university. What department of health you're going to be working with, assuming you are working with a department of health to manage an outbreak. Do they have their own communication person? Make sure the two, university and department of health, are talking to each other so you can really get on the same page and really make sure that you're consistent with your messaging and everything else. Then determine what your methods of communication are going to be, sending things out via email, updating websites, and how are you going to use social media and who is going to do that. Really having a plan to handle the media was incredible. The media response in this case, I know Philadelphia is a major media market, but it was incredible the attention that this got. We were on the 5 o'clock news every single day for about 2 weeks straight. It was incredible and kind of relentless. But we were very open and transparent with our communication. We said yes to just about every interview request. We looked at it as an opportunity to get the information out there. And the more we could get the information out, the better it would be, and the better we could do at getting a handle of things and getting in front of the outbreak. Parents, another challenge. It was a very big challenge for us. Temple does not have a listserv or an email list of all the parents, so we do not have a way of directly communicating with them. So that was something a couple days into the outbreak, I was able to connect with a person who manages a parent Facebook page. It's a private Facebook page. Temple administration, we're never given permission to see it or be members of it, but what I did was connected with her, and every time the university sent an email out to the whole community, I also sent her a copy to post on the Facebook page. So that really went a long way with communicating with the parents. And also the student newspaper, they wanted updates every day on how many new numbers, new cases. We had to really rein in their expectations and dial them back a little bit and give them the same updates we were giving everybody else. In the beginning, we really sent emails out every week. There was a couple weeks we sent 2 emails out when there was additional information to give. So our initial notification, I already mentioned how quickly we got it out. It was really a combination of notification and education, giving directions on what folks are to do. Anyone who's sick, come into the health center so that we can give them more education. I mentioned there's really no treatment for this, so it's really giving them the directions of what to do. And one of the biggest ways to prevent this from spreading and to kind of slow things down is to get anyone who's sick to self-isolate for 5 days. Stay in your residence hall, stay in your apartment, avoid close contact with other people for those 5 days that you're still infectious. And this is really where the relationship with housing becomes very important and very key, because they're instrumental and very helpful at trying to encourage and get students to self-isolate. Mentioned working with the local health department a lot and self-isolating. I probably said that 1,000 times during the 2 months of this outbreak, of the height of the outbreak, but it's really the only way to slow things down is getting folks to avoid contact, stop them from spreading the disease, and making sure that folks know what the signs and symptoms are, which are definitely confusing. This was cold and flu season, so it's really cold and flu symptoms with jaw swelling. So really trying to emphasize that and make sure that everybody knew what the signs and symptoms were. And then coming down to prevention and how do we prevent this from spreading further, encouraging the self-isolation. Any students that came in that were sick, we tried to identify who their close contacts were, who their roommates were, their significant others, family, really anyone that they have close, prolonged contact with. Another part of our messaging, not only to the students, but also faculty and staff, was that being in a classroom is not considered close, prolonged contact. The disease really is spread through droplets. You have to have contact with saliva or respiratory secretions. So it's not spread that easily unless you have that close, prolonged contact. A great example of that is my 40 or so employees within the student health office. We saw more actual cases of mumps than probably anybody in the country. Not a single one of my employees came down with the mumps. And we took standard precautions. We didn't do anything, beyond that. But you really have to have that close contact with folks in order to contract the disease. Something else we did, we sent out targeted emails. I mentioned some of the statistics about the housing students, athletes, Greek organizations. We sent some targeted emails to those groups because those are really the high-risk groups who are maybe they're partying more if they're in the Greek organizations, or they're living in closer quarters when they're in housing. Whatever the situation is, those three groups are really who we consider to be most at risk of contracting the vaccine or contracting the illness. So what did we do for the folks once we're targeting the emails, letting them know the signs and symptoms? The recommendation is for them to get a third dose of the MMR. So even if you've had the first 2 doses, get a third dose now. It's an outbreak situation. Insurance covered it because of it being in an outbreak situation. So that was really getting that third dose was the additional thing we encouraged. So the 3 things: get the sick folks to self-isolate, really contact those close contacts as well as the high-risk students, and then recommend the third dose to all students. So a few things that were specific to housing and how we work together with housing. We put together a few frequently asked question and information sheets, gave those as well as some posters and flyers, gave them out to the folks in housing to distribute amongst the students in housing, try to support the roommates of someone who was sick in any way possible. We never identified who was sick. Violating confidentiality is definitely a fine line in an outbreak situation, but we have to be mindful of confidentiality. So we wouldn't identify who the students are. We would talk in more general statements of, this hall has this many students, this hall has this many students. If we never recognized or found a pattern of there's a hall of 50 students and there's 40 students infected. That was never the case. It was really spread all over the place. If that were the case, we probably would have taken additional steps to protect those folks. So other things different universities can do, we were not in a position to move anybody to different housing. If you are in the position, that's great. But keep in mind, an outbreak can continue to get larger and larger. And at some point, you may no longer be able to move students into their own room for the period of self-isolation. Not to mention, you're only self-isolating for 5 days. So by the time they came to us, maybe day 1 or day 2 of their symptoms, there may have only been 2 or 3 days left for them to self-isolate. So by the time you find a room for them, the self-isolation period's over. So really the best thing to do for the mumps in the 5 days is just to support them in any way possible. One of those things is dining support. We worked with our dining services. We asked any of the students in the residence halls, would you like to have box meals delivered to your room? We would get a consent so that we could share that information with dining so that they could then deliver meals to the rooms. That went very well. It's not something, we didn't do that in the first couple of weeks. It took us a couple of weeks to do that. So that would be something I would really suggest, setting up a method to do that in the very beginning and really talk about that. Talk about cleaning supplies. We didn't do any extra cleaning for the residence halls of anybody who was infected, but we made supplies available at the front desk of the different residence halls. So students could come down and they could clean their residence hall, their rooms themselves. And it's also, we're fortunate, many of our students have their own room within their resident apartment. So there's very few communal spaces. So we really tried to keep them in their room. And if they had to come out into the communal space, wear a mask. Even went out to Amazon, bought some designer masks, really doing anything to encourage students to wear masks, self-isolate, make it as easy as possible. A couple things about the numbers. Our total number of people related with the mumps related to the Temple outbreak were 183 people, really spread over only about 4 or 5 weeks of time. 175 of those were Temple students. We did have a few students in other universities, as well as a few non-Temple students that were infected with the mumps. 35% of those infected were members of Greek organizations. Just emphasizes how important it is to communicate with them. 26% were in housing, and only 1 person in athletics. I really think that's attributed to them getting multiple communications. They have team doctors, they have athletic trainers. So not only did they get the messaging and communications from us, but they also got it from their medical staff that was on site within the training rooms, within the practice facilities. So they really got a lot of messaging, and as you can see, they really didn't have any spread of the mumps at all. So we did decide to have 2 mass vaccination clinics, got vaccine from the CDC. They released vaccine for us to use. We wouldn't, financially, it would be a very challenging thing for us to do that if we did not get the support of the vaccine from the CDC. Very short order to planned it in 5 days. We had it on 2 days at the end of March. Had roughly 70 volunteers day 1, 80 volunteers on day 2. The only way that we were able to do this in such a short period of time is we had the plans in place. We had a closed pod drill. We had already done this. We had done a drill the year before. So the spring semester of 2018, we had gone through a mass vaccination drill in the same location where we had these 2 drills. So we already knew what to expect. We knew what some of the challenges were going to be. We had a debriefing this morning, ironically, and everyone at the table agreed that there's nothing we could have done any better at these vaccination clinics. It was Disney-like precision and efficiency. We did almost 5,000 people over the 2 days. It really worked out extremely well, but we had our staffing all set ahead of time. We had an idea of who volunteers were going to be, who we could go to, who we could ask. So we really were very well prepared. If I can emphasize anything, plan ahead, have a drill. Definitely will not, if you never use it, great, but it's indispensable when it comes to actually implementing something like this. So I know I've talked about some of the barriers, some of the challenges, some of them unique to Temple, some unique to the mumps. One of the things, kind of the non-believers, people who, whether they don't believe in the vaccine, they don't trust student health, they don't trust the government or the Department of Health, people that, there was a petition at one point about closing the campus. So folks thought that the only way to end this was to close the campus, which absolutely was not going to do anything to help this at all. Quite frankly, I think it would have made things worse. Talked about how long the incubation period is for the mumps, 25 days. You may not know that you have the mumps. So we would have to close the campus for more than 25 days. Really not a practical thing. Disruption to education. When you talk about only 175 students out of 40,000, it's a very small percentage that had the mumps. We were very fortunate. We had no severe complications, really no complications at all. It was very mild signs and symptoms. Folks with a cold and flu had more severe symptoms than the folks with the mumps, at least in our experience with what we were seeing. So closing campus wasn't going to help. You close campus, students are just going to party for that time if they have no classes. So that wasn't going to help. But there was a very small number of folks who were very vocal that the only thing they wanted to hear was we were closing campus. They didn't care what else we were doing. If we didn't close campus, we weren't doing everything we could to stop the spread of the mumps. Student apathy. Like I mentioned, there's a very small percentage of people that were very vocal and were very loud, but the vast majority of students, it's mumps, whatever. My friend had mumps, they weren't that sick, they didn't really care. There was a wellness fair that was pre-scheduled in the middle of the outbreak, and I went to that myself, handing out flyers and information to several hundred students. Vast majority of them, I'll say they could care less about the mumps. It was like, oh yeah, here it's on campus, no big deal. So student apathy was definitely a challenge. We were very lucky that we got such a great response to the vaccination clinics, and we had so many students come out. I was very pleasantly surprised. It exceeded everyone's expectations in terms of the response and the number of students that came out. Our education and just the postering and the messaging we sent out is really the only thing I can attribute to that. It's just the constant, consistent messaging we were sending out. You know, it's something to be concerned about, but not to be overly worried about, not to panic about. You know, be aware, be concerned, but don't panic. The media, very big challenge. Doing interviews with the media, they will try and manipulate and spin things all kinds of different directions. So that was absolutely a challenge. Having that worked out with your communications department and having that lead and that liaison, being available, being transparent, all of those things can help manage it. But honestly, depending on where you live and where your university is, the media can get a little out of hand. And I can say here, they didn't help a whole lot. They definitely raised some of the panic level. Many parents that called were very panic-stricken from what they were seeing in the news. And then once they talked to us about what the reality on the ground was, they're like, you know, I don't feel so bad now. I understand things a lot better. Things aren't as bad as what Channel 10 says or NBC or CBS or whoever. So managing the media, definitely an issue. Communicating with parents, I talked about that with a Facebook page. All depends on what your university has set up to communicate with parents in terms of how to get that messaging across. Money. It's an expensive thing to try to manage this outbreak. The university was great. We offered the vaccine for students for free, and that was even before the CDC and the Department of Health gave us free vaccine. We also offered it for faculty and staff for free. It was something they weren't considered high risk. We only had 2 employees during this entire outbreak that came down with the mumps. One of those did live in housing. They were a housing director. They're almost as close to a student. They live in the housing, so they're definitely a higher risk than just your average regular employee or faculty member. Then we also did have 1 academic advisor who did come down with the mumps. But during the entire outbreak, it was only 2 employees. So the CDC and the health department declaring them not to be folks at risk, the data and the statistics really showed that to be the truth, with only 2 people becoming affected. But the university made a great commitment, providing the vaccine for free. You know, really, I just called up the chain and they said, Mark, spend what you need. They knew I was going to spend it responsibly. But this whole thing cost us about $150,000 for us. I think it cost the CDC and the Department of Health another $250,000 to $300,000. So definitely not a small thing. Staffing, know ahead of time where your staffing is going to come from, and I'll even put staff burnout in there. My staff was phenomenal. They were fantastic. They volunteered extra time. They just came in extra. It was a highly stressful time for them to try to be aware of burnout. I bought pizza a few Fridays, just trying to do things to alleviate some of the stress and really be aware of that. We brought in agency staff when we could, to alleviate some of that pressure on folks, because it was about 4 or 5 weeks of many phone calls every day, many patients coming in, mostly looking for the vaccine, but the stress level was definitely up there. So I've talked about strategies really throughout all of this, and building the relationships on campus, knowing who your person in housing to talk to is. If you're in housing, knowing who in student health would be the point person for dealing with something like this, and how's that flow of communication going to come? Who else in the health department? Do you have an office of emergency management? Who would you work with there? Who would you deal with there? And building those relationships and just knowing people ahead of time and thinking about these things before you get into a situation that you have to deal with it. Planning, just plan ahead, have a drill, definitely have a drill if you can. Try to get volunteers. If you have medical school, nursing school, get the students involved. If you have an education department or peer educators, get them involved, get a school of public health. Any health-related major, those students, they're gonna love participating in something like this, but have them help with a drill. They'll also wind up being volunteers if you have to do a mass vaccination clinic. So we had, like I mentioned, 70 volunteers one day, 80 another day. The Dean of Students was doing line control one day. So it was really all hands on deck, and we got support from around the university. And get to know your health department. Who's in your health department? Who's there? Build those relationships ahead of time so you're not scrambling with, oh, who do I contact if this happens? So hopefully that will help as well. And just trying to plan and think about things ahead. This is my favorite graph. So this is our weekly number of cases. So you can see we started at the end of February, very large spike up, kind of still was 20, little more than 20 cases a week. The star is when we had the clinics. And you can see a precipitous drop as soon as we had those clinics. May have been coincidence, may have not. I like to think we had something to do with it dropping. And it stayed down. We had a little bit of a spike at the end of April, but again, it was only about 7 cases, 6 cases in 1 week. And we've now had no cases since May 29th. We'll have to go 50 days before they declare the outbreak over. So we have about 17 more days to go. Ironically, I leave on vacation the exact day that the outbreak hopefully will be declared to be over. So I'm very much looking forward to that. Now I know we have some time left for questions. I saw one come up about a specific area for quarantine on campus. We do not, unfortunately. It's something that I don't know how many colleges or universities would have an empty residence hall room or an empty residence hall. If you do, fantastic, great, something great to use on campus. If we did have a different situation and they had to be quarantined for longer than 5 days, there are a few hotels in the area that we might use, including one hotel on campus. But for the mumps and it being only a 5-day isolation period, by the time we got them isolated, it would be time for them to leave. So it really, we didn't set up individual quarantine areas. So they went back to their residence halls. We did encourage folks to go home if they could. So if students lived close and they were able to go home for a few days, we had them do that. We also had the provost, again, that relationship with the provost, she was fantastic during this. She sent an email out to all the faculty to really try to encourage them to be lenient with attendance policies. You know, if student says they have the mumps, don't require a note for class. Student health, we don't give out notes for class. So we really tried to do as much as we could to make the students self-isolate and to encourage them to prevent the spread of the mumps. Are there any other questions? You can type it in the box. I don't know if Veronica, if you're there, if there's anything else out there, if anything I didn't address, anything you'd like to know more about, hear more about.
If there's any additional questions, you can type it in the Q&A box. If you do have a microphone or you joined with a phone and would like to talk and ask your questions directly, please raise your hand and I will unmute your mic. We did have one compliment. person said every single question they written down was you addressed, and it was a very comprehensive and excellent presentation so far.
Thank you, Victoria. Appreciate that.
A question, do you have any policies you can share or procedures?
Sure, I can send Veronica the picture of our infectious disease policy. Like I mentioned, it's only about a page. If you count the header, about a page and a half. So we kept it very basic, very simple. We did that intentionally to make it applicable to almost any situation, and following kind of those loose guidelines and detailing the specifics and catering them to whatever the issue is. Very rare I have no questions at all, or only a few questions. It means I must have talked fast enough.
Mark, what would you say the greatest lesson you learned was from this outbreak?
Really knowing the chain of communication ahead of time, and planning and preparation ahead of time. It may seem like a waste of time when you don't have a situation in front of you and you're spending a couple hours thinking about staffing and doing table layouts and designs of how you would do an infectious disease, how you would give out the vaccines. But when something does inevitably happen, it made things go so much more efficiently. We got incredibly positive feedback from the state health department. The mayor of Philadelphia contacted Temple's president to tell them how pleased and happy they were with the way we managed the outbreak. It really, just that planning ahead of time and knowing who to communicate with ahead of time, and then trusting your student health folks. And hopefully you have those relationships with them. Our housing folks are great. They know if I raise the alarm about something, it's something that should be raised. But usually I tamp things down and try to, I don't want to say lower expectations, but lower anxiety, and really give people a very layman's view on things. I had another question about a tabletop training on this topic at our institution. We have done that as well. So we've done tabletop drill, as well as an actual closed pod point of distribution drill. Yeah, I can talk to, so the other question related to that was a template for that tabletop drill. Our Office of Emergency Management, I can talk to their director, and I'm sure she'd be willing to share the format that they use for the tabletop. The one we did a few years ago, it was about anthrax and a crop duster flying up Philadelphia, spreading anthrax around. So it was, interesting.
Any other questions from the attendees today? Hearing or seeing none, I'd like to thank Mark. Thank you so much for presenting on what is a very important topic to many of us who work in housing and residence life. The primary focus of our organization. Like I said earlier, for everyone, a recording of this presentation will be available on the glacua.org website, so you can review the slides and the recording from today's webinar at that location. Look out for your emails. There should be a survey going out to you shortly about today's webinar. If you have any feedback, any thoughts, comments that you'd like to share with Glacua or our presenter, Mark, we'll definitely take those comments and make sure they get to their appropriate persons. Thank you so much for spending an hour with us this afternoon or this morning, depending on which time zone you're in. Mark, do you have any final words you want to share?
Just wanted to thank everybody for the opportunity. If you ever want to reach out, please, my email is on the Temple Student Health website. That was another thing that did happen during this. I spoke to folks at Penn State, Westchester, other local universities, Notre Dame. just to see what they were going through if they had gone through something like this in the past. So helping each other is a great thing.
We do have one person put their hand up, so I'm going to allow them to talk. Joanne? Are you still here? I think she left.
Yep.
Okay.
All right.
All right. Thank you. Have a
Okay.
great
Thank
day.
you, everyone.
Bye.